I was just going to kick off with a very sort of general question, just if you could tell the group a little bit about how you've developed your decision support arrangements in the Black Country and West Birmingham STP.
Excellent, thanks Gareth, and hi everyone. I guess the first thing to say is the development of the Academy started before I joined, and I think the Black Country and West Birmingham System's commitment to population health management and developing Academy is probably a big step in that. So the fact that they committed to a budget for a team and committed to appointing an Academy director, I think was probably a really big first step and has kind of set us in a really good place moving forward. So I was appointed as Academy director back in August, and I'm just trying to think of some of the principles that Simon mentioned before. So I'm not a chief analyst, but I'm a consultant in public health by background, and I'm currently in the process of recruiting a relatively small team to start with, but that team will have a range of skills. So we're looking for people with skills with quantitative analysis, qualitative knowledge management, evaluation, information governance, that kind of thing. So we'll have a range of academic disciplines in our team. We've done quite a bit of the recruitment now, and although people haven't started, I know what kind of backgrounds people have had. So I think it's really interesting that we've got quite diverse experience with people coming from academia, so universities, from social care, and one of my new colleagues will come from a water provider, so a really kind of diverse team, and I think that's going to be really interesting to kind of bring that diversity of views so people don't just have an NHS background. I think the other thing is we put quite a lot of emphasis on relational skills as part of that interview process, so I'm really kind of positive that these people will be people that can get out there in the system and work with people and develop relationships, and hopefully they should be in post by July, August. Our approach to our quantitative analysis is slightly different. I'm working with our CCG's Associate Director of Business Intelligence on that quantitative data analytical function. So we're looking at reinforcing the current CCG team through recruitment of graduate trainees. But we are, as kind of suggests in the scope, really planning on clearly separating that business intelligence and data management functions. In terms of our access to data, I think this is one area where we're a little bit behind in the Black Country and West Birmingham. We're currently in the process of procuring an integrated care record, and that will develop in scope over time. But that will be a core focus and source of our data to do our analysis. The other thing that we're really keen on developing is networks across our integrated care system once our team is in place. So we've taken some first steps towards this. So I think it was Simon that talked about the Leadership for Analysts programme that the Decision Support Centre has run across the Midlands. So we're duplicating that just for analysts within the Black Country and West Birmingham. So I think that's going to be a really good start in kind of developing a network of analysts who can work together to support the system. That's starting later this month, and that will be the start of our kind of quantitative data network. Another area that Simon mentioned is the evaluation seminars that the Decision Support Centre is running. We've been promoting these, so we've got about 10 people from the Black Country who are attending those, so that's going to be the start of our evaluation network, and they'll be working with our evaluation lead when they start. And given the team, we haven't really got the team in place yet, but we have still started to do some projects, and that's been mainly through a partnership agreement we have with the strategy unit as well. So we've done works on wide returns of healthy life expectancy, and we've done wide engagement around that report, and we've taken that to our ICS board and agreed some recommendations which we're starting to take forward. And I think that kind of highlights that one of our key focuses really how as a system we start to move from insight to action. And Peter just described some of the reports that we're receiving. So we're really going to focus on how we move those pieces of actionable intelligence to action. So we're working hard to make sure they're received by the right boards. We're taking advantage of the Decision Support Centre's action planning sessions to start to develop and prioritise actions, but we're also going to invest further in making sure we've got support for task and finish groups to make sure that we take the first credible steps towards change. So I think that's been one of the limiting factors in our system in the past, is we've had intelligence, but we haven't necessarily acted on it effectively.
Okay, no, that's great. Thanks, Lucy. That's really comprehensive. The next question I wanted to pose to you was how have you interacted with the Decision Support Centre and the wider DSU network to date, and how do you see that developing over time?
So the Decision Support Centre has been probably essential in my kind of first steps as developing the Academy. I've had lots of support, both from having experts within the Decision Support Centre to discuss the kind of strategy that I've developed as an academy, but also in developing job descriptions and the recruitment. So on each of my panels, there were Decision Support Centre members on the panel. Like I said, we also have a partnership agreement with the strategy unit, which is linked to but outside of the Decision Support Centre. So a lot of the resource I've had to do work in the first kind of 6 months has come from the strategy unit and colleagues that are involved in the Decision Support Centre. In terms of the Decision Support Unit network, and we've probably taken a bit of a lead in working with Decision Support Centre on that. So Paul Moback, who's our accountable officer and the SRA for the Integrated Care Systems, the chair of the Decision Support Centre strategic group, and then I chair the operational group. And I think those groups are really developing and starting to help us feel like a group of peers across the Midlands. And we have obviously discussions within those meetings, but also communication outside of those meetings to support each other. I think the key areas we probably work together on to date is thinking about information governance and about our developing integrated care records, having a bit of a focused debate on if or how to share that kind of data with external agencies. And then the other area I think we've been focusing a lot is how we encourage each other to make the most of the Decision Support Centre reports that are forthcoming. The other area where we've probably been particularly involved is through the educational programmes and the networks that the Decision Support Centre hosts. So with the educational programmes, I think we've taken up our share, or more than our share, on the educational programmes. And as I mentioned earlier, we're duplicating at least one of them locally so that we can reach a larger group of people. And then also our analysts join the analytical huddles and all the regional huddles that the Decision Support Centre are developing. We will join, and that will support our local ICS networks as we develop them as well.
Yeah. Okay, no, that's great. My next question is probably one that's really sort of critical for people listening on the call. So what advice would you give someone trying to set up a similar arrangement within their own system, you know, in terms of a sort of cross-system intelligence function, a DSU type arrangement? Have there been any sort of unexpected challenges you've encountered, or what do you see as been the key building blocks?
So I think the system investment in the Academy has been essential for us to get to the point where we are. I feel very fortunate this is my full-time job, and I know a lot of my peers trying to do this in other systems are doing this alongside other full-time roles with this as an additional function for them. So the fact that it's my full-time job means that we can move forward quickly. And when I've got the team in place, I think that will further accelerate. And I think this also allows us to take a broader view of population health management, whereas I think a lot of systems perhaps have just been focusing on trying to improve the data. But coming to the kind of challenges, I think that access to the data and getting better data is probably, well, not unexpected, but maybe a bigger challenge than I expected it to be. So I thought it would be easier to access data and sort out information governance than it has been. So while we sort that out, that's still a hurdle we need to overcome. And I think there's lots we can learn from other systems who've got further on that journey than we have. But like I said earlier, there's lots of actionable intelligence already available to the system that we haven't acted on. So that's my real focus in the short term while we're resolving the challenges around getting better data, is to try and use the intelligence we've already got to make some change.
Yeah. Okay, no, that's great. And just finally, what motivates you to push on in developing a decision support unit for your local system?
So I think my vision for the Academy is to make choices matter for the health and wellbeing of the Black Country and West Birmingham. And I think we can really do that by supporting better choices at all levels. So I get involved in lots of different things, but we're looking at how we support choices for individual by looking at personalised care and encouraging shared decision making, but also using that to collect better data about what's valued so that we can make better decisions at a system level, not only informed by the data we've already got and the intelligence we've already got, but also by the needs and wants of the people that we serve to really drive change.
Yeah.
And I really hope that that kind of work and that kind of focus will really give us the opportunity to impact on healthy life expectancy and reducing inequalities in a way that we haven't achieved in my previous 20 years working in and around the NHS. So I'm really hopeful that having a decision support centre and using better intelligence to inform decisions and ensuring those decisions achieve better outcomes will hopefully really mean that we can make an impact on what's really important.